All right, so this is an extra video just to review the lower leg rotation. We really want to make sure that we are feeling this rotation. So it can be helpful to explore this without standing. Sometimes the standing is a little bit challenging, and we want to bring a little bit more attention to the details so that we do the movement correctly. You can see that there's a kind of a blade here of the bone of our lower leg, and we kind of want to think that we're twisting that blade inwards and outwards, back and forth, as we perform our extension and flexion. But for now, we're just going to explore moving internally and externally and see, can we just move this part? So I'm gonna have you with your hands behind you if that's comfortable. If this is uncomfortable, you can always sit on a chair and just do this seated from a chair. Seated is on the floor is totally fine, but if your body does not allow for this, then you could sit on a chair and do the exact same movement. So what we're gonna do is lean back a little bit, flex your foot as much as you can towards your knee, and then you're gonna just try to rotate back and forth. So I'm not doing this. So you can see this is my ankle, and then this is my knee. So my foot and ankle are staying static throughout the entire movement. I'm not doing this. And it might seem like a little difference, but it's a big difference. This is my ankle. This inversion, eversion of my ankle is not what we're looking for. We're squeezing the front of our shin to pull our ankle into dorsiflexion. So if you are moving your ankle, it might take some time to start disassociating those joints, your knee from your ankle. It's very common that it kind of gets clumped together, but we do want to eventually start disassociating those joints slowly. So just move back and forth nice and slow. You can even use your hands to gently guide it. If you notice that it's really hard, just kind of gently, you don't have to push very hard at all, just very slowly. Okay, and if it's really hard when it's folded like that, you can even bring your knee even closer. We don't want to be working through any pain or pinching. So if you notice that you have that, find a position a bit more extended, somewhere between here and here is usually pretty good. And we're just playing with this. We're not thinking too hard.